Hello again. Are you guys ready to move on to module 1.3, where we go over common lower GI dysfunctions? This is not my favorite topic, so you will be able to tell, but you have to understand how these diseases are affecting you if you have them, because a lot of people are diagnosed with IBS, irritable bowel syndrome. And what is irritable bowel syndrome? And that's what I'm going to walk you through today and really help you understand what this condition really means, because in conventional medicine, it's an idiopathic condition, meaning we don't know why, you just have it. So irritable bowel syndrome is a functional gastrointestinal disorder characterized by chronic abdominal pain, bloating, altered bowel habits like diarrhea, constipation. So you can have both, or you can have diarrhea dominant or constipation dominant type. Now, this is where the bowel basically have abnormal contraction causing pain. But if you really look at the root causes, this is where you're going to see the difference between functional medicine and conventional medicine. So the signs and symptoms that you deal with is abdominal pain, a lot of discomfort, bloating, gas. And what a lot of people have deal with is that they eat something, or they are stressed, or they are dealing with something emotional, and then they have to run to the restroom and have diarrhea, or they can't have bowel movements and are pretty chronically constipated. And then chronic constipation, if you guys haven't experienced what that is, it is horrible. I experienced it after a surgery. It is painful. You're tender, and then you just feel so much discomfort in your gut, but in your whole body, because toxins are just building up in your system. And then now your system is laced with toxins from the gut. That's why it's so uncomfortable when you're constipated. Right. And the consequences is that it reduces your quality of life. Most of my patients who have IBS, they're either just always anxious because they're worried that they're going to go have a bowel movement at any time. Some of them, if it's severe enough, then they would, stay home. They won't even leave the house because they don't know when their diarrhea is going to come. And then they go like 10 times a day. And then people miss work, miss school because their symptoms are not treated properly or mistreated. There's an increase in healthcare costs across pretty much the population who deals with this. And then there's a lot of comorbidities like chronic pain, psychiatric disorder. Now, I want to distinguish here why they have this comorbidities is because when you have inflammation in the gut, right, which is what IBS is, these non-specific dysfunction, where they can't truly give you a true diagnosis, or they don't know how to treat, they group and they just kind of give you this diagnosis of IBS. Well, that is, even though this is a diagnosis that you may be given, this is not how you want to look at your symptoms, because knowing what your diagnosis is makes no difference, right? Just because you have IBS doesn't mean you understand why you have IBS, and doesn't mean you can treat it effectively. But worst of all, you just have symptoms and you just suffer, right? And that's where we can end this suffering if we learn to look at this differently. Instead of looking at like, oh, I have IBS, you want to look at, well, why do you have these symptoms? So the root causes of these symptoms of bloating, pain, and diarrhea and constipation is that if you have, let's say, diarrhea, it's a sign that your gut is inflamed. So inflammation is what's going to drive your system to say, hey, we're exposed to something that we need to expel right away. There's no time. So let's just increase the peristalsis and let's squeeze all of these toxins out so that we can remove it from our system. That's essentially the role of diarrhea. And diarrhea, if you look at it, is actually a defense mechanism that we use to protect ourselves from toxins. Same thing as vomiting and nausea. When you consume something, or when you're exposed to something and you have nausea and vomiting, guess what? It's because your gut detects that there is something really bad here and we need to get it out as soon as possible. That is why you have diarrhea. Constipation is more because your gut, when I keep saying your, I shouldn't say that. The gut has chronic damage to the nerve or the peristalsis motion that pretty much make your gut paralyzed. So you're not having that contraction to move stool forward anymore. So it's actually a sign that your gut is not functional, right? And then you can have blockages too when you have constipation. And then if you have bloating, so I mentioned earlier that bloating can have many causes, but the main two causes is that when you don't digest food well, so if your stomach doesn't produce enough stomach acid,